Hello and health talk for Marz. It's out of this world and welcome to another episode. Today we're going to discuss a very important topic, and that is your multivitamin killing you or at least decreasing your health? So stick around. So in today's episode, we're going to learn about why your multivitamin needs to make sure that it does not have iron in there. One of the things that's critical to do is to make sure that you are actually indeed low in iron. Iron deficiency is one of the most common forms of anemia in the world today. However, in this day of plentiful food, one of the problems that we have is that people are getting too much iron. And what we know from genetics is that 1 out of every 15 people carries one of the genes that codes for something called hemochromatosis. Hemochromatosis is where you store extra levels of iron. If you have the homozygous condition for hemochromatosis, you will not live very old. Usually by the age of 30, you start developing pretty severe atherosclerosis. That means all your tissues become oxidized. So you want to be especially sure that if you are taking an iron supplement in your multivitamin, that you indeed have low iron. So what to ask for your physician if you're trying to find out if you do in fact need iron? Well, there's a few simple tests that can be done inexpensively to determine actually how much iron is in your tissues. Knowing how much iron is in your blood is not enough. Knowing how much is in your tissues is actually really very important. So there are two main tests that I strongly recommend that you get checked. One is called ferritin. Ferritin is a measurement of iron stores in your tissues, but also is an inflammatory marker. So it can be elevated for different reasons. The second test is called the percent transferrin saturation. And this is a marker that easily can be done, showing you like if your level of iron is way higher than it should be. So what we know is that 1 out of every 15 people carries the genes that codes for hemochromatosis. 1 out of every 225 people tend to be the homozygous condition, which means that you carry both genes, and that's a much more serious condition. However, even if you're heterozygous, it may be possible that you have too much iron in your tissues. So the other thing to look at is your CBC. CBC is a blood count, simple blood count, and one of the things that you want to look for on your CBC is something called MCV. MCV stands for mean cell volume. Mean cell volume determines how big your red blood cells are. So normally the mean cell volume is between 80 and 100. So 90 means that you're right smack in the middle. When your cells get smaller, that is when the MCV is below 80, that means you have microcytic cells. So classic microcytic hypochromic means lack of color. Anemia is assigned to iron. But you can also have microcytic anemia from B6 deficiency and also from copper deficiency. So look for those two things as well. So why is iron so critically important for human survival? Well, you cannot make hemoglobin properly without iron. Iron is the central core mineral that's involved in hemoglobin. So when hemoglobin lacks iron, that's when the hemoglobin has less color, and that's why it's called hypochromic, lack of color, and microcytic means small. So if your cells are large, chances are really good that you don't have iron deficiency. And so that's something that you want to take a careful look at. There is a more sensitive marker that you can do if things get a little bit more complicated, and that's called soluble transferrin receptors. The body, in its wisdom, makes more of these receptors when it believes that it's iron deficient. So if you have a lot of soluble iron receptors in the blood, could mean that you have low levels of iron. and that would be more of an indication to take in iron as part of your multivitamin supplement. Okay, let's talk about iron, and let's talk about some of the lab values. So in ferritin, I like to see ferritin levels somewhere in the range of, for females, 20 to 70. In males, I like to see a range of maybe 30 to 80. So that would be the optimal amount. So you can't live without iron, so you need to have enough of it. But if your CBC is normal and your cell size is normal, there's no need to be supplementing iron in there. So you want an optimal level of iron in your tissues. So the other lab test I mentioned was the percent transferrin saturation. The normal reference range for transferrin saturation is between 20 and 50. Ideally, I like to see that number less than 40%. In females, you can go down to 15% and that would be fine, as long as your CBC comes out normal. So keep those numbers in mind. Ask your physician if they'll check you for your iron stores. And sometimes they'll balk at it, but it's something that is really a very important part of optimal health. You don't want too much iron, and you want just enough to make your red blood cells happy and to be in good color standing. That is, to make sure they're not hypochromic. So, okay, let's talk about not optimal levels of iron. That would be if your iron levels are too high. So that is if you're over 40% on the percent transferrin saturation and you're over 100 on your ferritin. So if that's the case, you definitely want to try to get your iron levels down. So typically what's recommended is blood donation. So they've actually found that blood donation is actually protective against a number of different conditions, including heart disease and diabetes and cancer. So what we know is if your level of iron is higher, your chance of all-cause mortality goes up significantly. So as the numbers get higher and higher, the number of people that get ill with various diseases, such as diabetes, which is a big one, because iron can damage your insulin receptors. Iron is a pro-oxidant compound, and when you have too much circulating around in your tissues, what happens is the insulin receptors become damaged, and when they become damaged, you start to produce more insulin, and more insulin leads to inflammation in the body and also some other pathologies as well. So you need to know your numbers of where you are for ferritin and the percent transferrin saturation. And that is, if your levels are above 40% transferrin saturation and above 100 ferritin, good idea to maybe do some blood donation. What we know is that females have lower incidence of cardiovascular disease premenopausal. As soon as they turn menopausal, their rate of heart disease catches up to males. And again, the reason is because they're blood donating on a once-a-month basis. And that can be very effective for males at lowering their risk. Also, that will decrease your hematocrit, which is good because if your hematocrit's too high, it significantly increases your risk of clotting. And so we don't want your blood to clot because that will be one of the main causes of strokes and heart attacks, clotting of the blood. Okay, so aside from, certainly doing blood donation to decrease your levels of iron, certainly your diet has everything to do with this. So what do we know about diet? What we know is that if you consume iron from animal sources, your level of absorption of that iron is greatly increased. So heme iron, which comes from animal sources of iron, is much better absorbed. So if you have anemia, certainly doing animal sources of iron better for you. If you have the heterozygous condition for hemochromatosis, where you have some higher levels of iron in your body than what are optimal, then definitely going to a more plant-based diet is going to be beneficial for you. So addressing this topic of, optimal levels of iron, there's a great chapter in the book, Becoming Vegan, by Brenda Davis and Vansanto Molina. And in that book, in that chapter, it describes in detail a little bit about foods and how foods may be a pretty big source of iron, that contribute to your declining health due to the fact that you have too much iron. So a plant-based diet is going to be more beneficial for people that have higher levels of iron than optimal. Okay, so I mentioned previously about multivitamins and if they have iron in them. The only time you should take iron, any kind of iron, is if you are proven to have low tissue levels of iron. So one of the other benefits of not having iron in your multivitamin is that iron tends to be a pro-oxidant. And that means that inside your vitamin tablet or capsule, it can oxidize some of the other nutrients like vitamin E and vitamin C and carotenoids. So you don't want that. So it's a good idea if you are taking an iron supplement to take it separate from your multivitamin. And if you need to take iron, probably going to need to take a lot more than what's in the multivitamin supplement. So taking iron together with vitamin C significantly enhances the absorption of iron, because iron is not easily absorbed from the digestive tract. So making sure that you have some vitamin C to keep iron in its reduced form is a really good idea. I also recommend doing a sustained release type of iron that would cause less irritation to the GI tract and less nausea. Let's make sure that your level of iron is optimal. You can repeat your lab tests in as little as 3 months to see where your numbers are. But definitely you want to monitor the numbers to make sure you're at that optimal level for tissue level of iron. When iron gets too high in the body tissues, it can actually be picked up on an ultrasound of the liver. You can start seeing iron accumulating in the liver, just as you can see fat accumulating in the liver as well. Okay, so now that you know what optimal levels of iron are in your tissues, you can, evaluate whether or not you should be taking any type of iron in your multivitamin supplement. One thing to consider is that iron in your multivitamin supplement can actually oxidize some of the other nutrients, such as vitamin C, vitamin E, and carotenoids. So it's a good idea to take your iron separately. Back in the 80s, I developed my first multivitamin formula called Omnivite with that in mind, with the idea that you should take iron separately from your multivitamin. And so if you're taking vitamin C together with iron, that will greatly enhance the absorption of iron. So take them together but separate from your multivitamin supplement. And you can check out Omnivite, my multivitamin product that I developed, in my website, marznutrition.net. And thanks for joining me from Health Talk from Mars. It's out of this world, and I'll see you in my next episode.